Hello and welcome back to my YouTube channel. I hope you guys are having a very good day today. Today I'm going to talk about a very interesting and very important topic for international medical graduates, for junior medical doctors, for final year medical students, for those who are in fourth year medical, what they should be doing, what should they be planning. I will be giving you a very, comprehensive guidance. What should be your way forward? I know when I was in fourth year, final year, we were always puzzled about USMLE's PLAB AMC. What should be our line of action? How much money I have got in my account? How am I going to do my visa? How am I going to sort out all the big problem? So I have some time today, so I thought I should talk about it. So let me explain you a little bit what's happening currently in United Kingdom. As you all know that we are having a pandemic for last 2 years. During this pandemic, the normal functioning of the whole hospital is affected. Elective procedures and follow-up treatments, investigations, they've all been delayed. At this stage, when we are talking, nearly 5 million patients are actually waiting for their treatments to be done, which is a huge, huge, huge number. You may have seen recently that those doctors who have passed the plabs, they couldn't get the job. It's not because that we don't have vacancies. We have a lot of jobs. So many slots are vacant. If you go on NHS website, it's just the recruitment process is a bit slow, and the doctors who are sitting abroad, it's hard for us to recruit them. The HR is working from home, occupational health, and so many other divisions in the unit who actually participate in recruitment. They are not actually working the way they should be, and it's very hard for us to interview someone who is overseas in the red list country, and then we sponsor the visa and then they come, so it delays everything. We definitely need lots of doctor now. As soon as the COVID situation will get better, which I believe by September, October, Pakistan, India, they will all be out of the red list. People will be vaccinated. They will be, the traveling will be resuming with slight bit of restriction, but you will be able to commute. So now those who are thinking what they should do, USMLE, PLAB, AMC. So I say to them straight away, go for PLAB. Just go for PLAB. It's easy, it's smooth, it's financially viable. And compared to America, compared to Australia, there are 90% more chances that you will get a job. Now, this is a big statement, isn't it? So let's assess and analyze the system in America and UK and in Australia. How the system works there. In America, the junior doctors can either go through the training pathway. There's no other parallel system. And you know that training is always hard to get into. Not only in America, even in Pakistan, the training posts are difficult. And the chances are very, very slim. So even 90% of the time, you will not, even if you've got USMLEs 1, 2, you will hardly any chance that you will get a job, because it's not that you're not competent. It's not that you don't know your stuff. It's just because their system. It's just because there's only one way, there's only one channel to go through. So I say, please don't waste your time in USMLE. I did it, and you know, it didn't work for me. It didn't work for many people like me. So compared to America, in UK, we have so many different options. You have a training options, you have a non-training options, you have clinical fellows, you have locums. You know, the system is so strong here that we can train anyone. We don't have to be you don't have a training post. You can easily start as a non-training post. You can do a clinical fellow post, you can do a trust grade post, which you can get easily once this pandemic will be over. I can see now, tomorrow, we are having interviews, and we are interviewing so many people, and I'm sure most of the people will be getting jobs. uh, and I've seen many trusts have recruited 11, 11, 12, 12 doctors now. So the jobs are opening. People will be traveling easily. So my suggestion to all of you is just go for PLAB. It's easiest way to get into UK. It's the shortest possible way, and from there you can actually travel. Later on, 1 or 2 years later, once you're financially stable, you can move to Australia. You can move to America. That's not a problem. Now, I said about America, don't try that. Now, I will be talking about Australia. More or less similar. Sorry, it's very, very hot here because it's summer and we are enjoying the summer weather. So you can see I'm sweating, which is good. Then coming to Australia is again same problems. You first of all the IELTS requirement is quite high. Then again it's too far. Social isolation is a problem. You will be in the completely different globe. And the most important problem is there's only one way there. There's only one system of the training. If either you're a training doctor or you're no one. So I completely disagree with that format. I completely disagree with that model of training in America and Australia. I think more options should be open, like MOs, RMOs, PG ships, clinical fellows, trust fellows, academic fellows, like we have in UK. So anyone can get a chance in UK. All you need is a PLAB, and I can guarantee you that in upcoming year, maybe in 21, once the 2021 is over, if you are in 2022, 2023, whoever has done PLAB, he will definitely, I'm quite sure, they will get a job. There is a very high chance that you will get a job. So plan for that. Coming back to MCC Canada, Canada is a big no. Do not ever try to even think about Canada if you are planning to work as a doctor. There's only one way you can go for Canada, which I will be talking in my next video, which will be about how is Canada for the doctors. It's a completely different format. I can talk about it. But at this stage, this video is mainly about if you have an option to select between USMLE, between FCPS, between MRCS, between MRCP, between AMC, just focus on PLAB. That is the best option at the moment. And for that, what preparation you need to do, I say start preparing while you are in fourth year, start preparing while you are in final year, start reading books, start joining the forums, see what is the format, what's coming next, and start preparing financially. The best advice I would say, please see if you have a gold, if you have some extra car, or don't just leave it in your cupboard. Just put that money in your bank account. At least if you have 5-6 lakhs in your bank account for 1 or 2 years, that shows that that's your money. And when the time of visa application will come, that 5-6 lakhs will be a very useful bank statement. When you apply for visa, you get it straight away, rather than roaming here and there. Ask your friend, family, relatives, whoever can help you. Start putting money to your account, and must do your house job in medicine and surgery. Do not make this mistake. You should do 6 months medicine, 6 months surgery, irrespective you like it or not. Irrespective you like it or not, you must go for medicine and surgery. Do not leave house job. You have to do the house job. And while you are in final year, start preparing for PLAB, IELTS and PLAB 1. IELTS and PLAB 1, or OET and PLAB 1. While you are in house job, start preparing for PLAB 2. And then as soon as you've done the house job, you should be ready for departure. One more mistake people do not attempt OET early or IELTS early. You should have a clear plan in your mind that you should be able to complete everything in 2 years. All right, I've seen so many people, although GMC has extended the validity of IELTS and OET because of the COVID, but I don't know how long it's going to be there. We are more than happy to help you out. I work as a consultant in UK. My wife works as a consultant. She is a clinical lead as well. So we are here on Pakistan Medical Career Counseling page. Me and my wife, we read all your messages. We read all your queries. We reply to most of them. If you're precise in your question, we will reply. But don't just ask, please guide us about the PLAB one. It's very difficult for us to answer that. If you have one question straightforward, ask that precise question, we will reply. But for the PLAB 1, PLAB 2, there are forums available. There is a lot of guidance available. Just start reading about it. And I'm quite sure that Pakistani doctors, you can make it. Thank you very much. I hope you have a good, lovely year ahead. Dr. Ash, join my YouTube channel for such videos and share with your friends and tag them. Wish you best of luck.